everyone, my name is Vaninder Dhillon. I'm one of the laryngologists here at Johns Hopkins Otolaryngology in Bethesda. Today, my speech therapist, Michelle Wilson, and I will be discussing chronic neurogenic cough. Chronic cough is a cough that lasts over 8 weeks or more. It's debilitating, and it is one of the primary reasons patients come into their primary care doctors or see subspecialists because of the dysfunction that it causes. There are many causes for chronic cough, but the role of myself as a laryngologist and our speech language pathology team is to see those patients who are refractory to common medical management for cough. Chronic neurogenic cough is one where we feel that there's a hypersensitivity to external stimuli that causes the cough, one where we feel the larynx is the primary source for the cough, triggered by normal things in the environment that unfortunately can't be changed. However, socially, functionally, professionally, it can be very debilitating to have this symptom. So coming in to see a team like ours, it can help in starting a new treatment plan for your cough. Today, we will be talking about treatment for cough and also focus on a new alternative, which is the superior laryngeal nerve block. But first, I'd like to introduce Michelle Wilson, our speech therapist, to talk about the behavioral therapy surrounding cough treatment.
Hi, my name is Michelle Wilson. I'm a speech language pathologist with Johns Hopkins Otolaryngology Group down here in Bethesda. And as a speech language pathologist, part of my scope of practice is helping treat these folks with chronic cough. And my interventions can work on more of the behavioral side of breaking that cough irritation cycle. This may include finding out triggers to your cough, such as certain environments or certain other things in your life that might contribute to this cough. It might include working on vocal hygiene, such as making sure that you're drinking enough water, and also figuring out certain strategies that might help break that cycle. Certain things that might include like a sniff blow technique, or a hard swallow, or simply taking a sip of water. We work on these things together to figure out how to best treat your chronic cough in a more behavioral standpoint.
So I'm going to demonstrate the superior laryngeal nerve block, or the SLN block, which is a new treatment that is currently being studied for chronic neurogenic cough. Because we feel that there are triggers from the normal environment that trigger chronic neurogenic cough, one thought is with the superior laryngeal nerve block, we are able to desensitize the actual nerve, which controls how we feel everything in our larynx and the back of our throat. So in an effort to actually block this as an alternative to medical management, we perform these procedures in the office. It's a very simple procedure. However, it does take the patient in an office chair, such as this, and myself as a provider with the actual material in the form of an injectable. The components of the nerve block are typically some form of local anesthesia in the form of lidocaine, as well as Kenalog or triamcinolone, which is a steroid component. And in a directed fashion, the goal is to perform this using palpation. So a lot of it is based on the physical exam. The area in which we perform the nerve block is at the thyrohyoid space. The larynx from the outside is part of the airway complex. The windpipe, which is in the middle of the airway, is formed by the trachea, two cartilage structures known as the cricoid and the thyroid cartilage, and then the hyoid bone, which sits right at the superior portion of the larynx. The space in which we want to perform this injection sits right above the thyroid cartilage and below the hyoid bone. That is where we feel the superior laryngeal nerve comes out. So in a palpatory manner, I'm feeling the right and the left. And if a patient describes a trigger or an urge to cough, we usually choose that side for the first injection. These injections are done in a series, and that is dependent on the provider and the patient. We hope today's talk on chronic neurogenic cough, as well as superior laryngeal nerve block, was educational and informative.
If you need help with your chronic cough, please reach out to us at Johns Hopkins Otolaryngology down in Bethesda.
Thanks, guys.